day everyone, I'm Daphne from GS Respiratory 22. So for today's video, I'm going to demonstrate postural drainage. But first, let's take a little background about postural drainage. Postural drainage is also known as chest physiological therapy. Here are the goals of CPT. Number 1, to remove bronchial secretion. Number 2, to improve ventilation. And number 3, to increase efficiency of respiratory muscle. Here are the contraindications of CPT. Head, neck, and spinal injury. Hemodynamic instability. Increase intracranial pressure. Hemoptysis. Bronchopleural fistula. Pulmonary edema as a result of CHF or congestional heart failure. Pleural effusion, and last, flaring chest. Before we proceed to our patient, it is very important to disinfect our hands first by using of hand washing technique.
Always remember, a good hand washing is the first line of defense against the spread of many illnesses. Whether you are at work, home, and traveling, always wash your hands frequently. After washing your hands, use a clean cloth and alcohol for disinfecting. Since it's still pandemic, I decided to use a glove serves as my PPE for this demo. As an aspiring RT, it is very important to learn disinfection while in practices. Before I start my demonstration, I disinfect all the equipment that I will going to use to my patient. These are the following equipments: pillows, gloves, alcohol, mask, and lastly, towel that we'll be using for percussing and vibrating.
I have here my patient, Nigel Santos. He is 11 years old at bago natin simulan ay aalamin muna natin ang diaphragmatic breathing. So sir, ilagay po muna natin dito yung right hand natin at umubo po tayo. May masakit po ba? Okay, so after naman po nito dito, inhale, exhale, inhale. So first position is upper anterior segment.
Is for secretion for the both apical part of the lungs or upper lobes of the lungs. The patient must sit up in the bed.
Next is posterior apical segments.
Is for secretion at the back and top of both lungs. The patient sit in bed and lean forward for better and easy way of moving secretion.
So next naman po ay anterior segments. So,
Is for secretion for upper and top of both lungs. The patient lay facing up in the bed with facing pillow under his knees.
so next one is right posterior segments.
Is for secretion for upper portion of the patient lay on the bed with knee or in bending side. Place a pillow in his abdomen.
So next one is left posterior segment.
Is for secretion in the upper back. The patient lay on the right side with the placement of the pillow in your left abdomen side. for secretion in the middle right of the patient lays out and places one pillow at his back.
So next is left inguinal.
Is for secretion in the middle left lung. Raise the bed with 12 inches.
Next one is anterior segments.
Is for secretion at the front and lower of both lungs. The patient lay facing up with the pillow under his knees for comfort. Elevate the bed with 18 degrees.
The next one is right lateral segments.
Is for secretion at the back portion of the both lungs. The patient lay facing down with the pillow under his abdomen.
So next one is left lateral segment.
Is for secretion lower back portion of the lungs. The patient is on the right lateral recumbent position.
Posterior segments.
Is for the lower portion of the right lung. The patient is on the prone position and elevate the bed with 18 inches.
So last position is superior segments.
The patient is on the prone position
Position number 1, I'm going to use a towel for percussing and vibrating. number 7. Position number 8. Position number 9. Okay, so sir, position number 10. Position number 11. Position number 12. So after the procedure, we must disinfect our equipments just like what we did earlier. So after we disinfect our equipments, we must do the proper waste disposal.